Hi and welcome to another video. Today I'll go over acute lymphoblastic leukemia. For some overview, I'll go over the background information, the pathophysiology, the clinical presentation, key investigations, before finishing with management and prognosis. So, for some key background information, it is the commonest cancer in pediatric patients, and in fact it accounts for almost 25% of all pediatric cancers. It is a malignant disorder of the bone marrow, where many lymphoid progenitors proliferate uncontrollably. The highest incidence for ALL is in those ages 2 to 6, so it is mainly a pediatric condition. However, adults can also be affected. And some of the key risk factors to be aware of are male sex, family history of ALL, and Hispanic heritage, as all of these has been linked to an increased incidence of ALL. The pathophysiology of ALL is quite complex and not fully understood. However, it is believed to be a mix of genetic and environmental factors. So environmental factors include things like viral infections, radiation exposure, or even poor maternal diet, whereas genetic factors include conditions such as Klinefelter syndrome, Down syndrome, or Fanconi anemia. What happens is there is a genetic mutation in the progenitor cell. This results in a proliferation of lymphoid cells, and that proliferation is uncontrolled and cannot be halted using the normal cellular mechanisms. There is, as a result, an excessive number of immature blast cells present, and this results in overcrowding of the bone marrow, which then causes a drop in function of the white blood cells, red cells, and platelets, as there is less space and less energy to produce all the other cells, as well as functioning white blood cells. The clinical presentation, this all translates to, well, there is bone marrow suppression symptoms, so things like lethargy, paleness, easy bruising, all of this is linked to less amount of red blood cells and platelets. There can also be bleeding, and you also have leukopenia symptoms, and that includes fevers and frequent infections. It's important to consider ALL, especially in younger children, presenting to an emergency department where parents complain of easy bruising. Another diagnosis to think of in very young children presenting with bruising is abuse. So it is important not to jump to either conclusion too early on. Other features to be aware of includes bone pain, abdominal pain, weight loss, lymphadenopathy, and hepatosplenomegaly. Symptoms can be non-specific, and patients may present with some, not the others, or present with some non-specific symptoms, and therefore further investigations are key for an accurate diagnosis. In terms of investigations, you want to first start with a full blood count, which would show anemia, but very, very high lymphocytes. You also see thrombocytopenia, and again, this is due to the suppression of the bone marrow due to the overproduction of blast cells. In a peripheral blood smear, you would see leukemic lymphoblasts present. Normally, you would not want to see any or not very many blasts in the peripheral blood film. And in fact, if the level of lymphoblasts exceeds 1 to the 10 power of 9 in the peripheral blood, bone marrow aspirate isn't even needed for diagnosis. However, normally it is typically still performed. Bone marrow aspirate confirms the diagnosis, and you would see hypercellularity with at least 20 to 25% lymphoblasts present. You can also perform kidney and liver function tests to get a baseline before starting the patient on chemotherapy. The levels may be elevated, and that could be due to dysfunction that could be related to the ALL itself. There are other investigations such as the coagulation profile or immunophenotyping, as well as cytogenic analysis that may be undertaken to see what kind of ALL the patient is presenting with, as there's new therapies that can target specific alterations and mutations, which is why this may be undertaken. With regards to management, you want to give them IV fluids to prevent hyperviscosity with how many blasts the bone marrow is churning out. You also want to do chemotherapy. You can also use allopurinol and respiricase to prevent tumor lysis syndrome. And of course, there is bone marrow transplant as a curative option. With regards to prognosis, it is very good in children, over 90% 5-year survival rate, but in adults it is only 40 to 60% 5-year survival. Regular follow-ups are needed for the first 5 years after treatment, and you can get complications such as secondary malignancies, infertility, and avascular necrosis of your bones secondary to the chemotherapy. Hope this brief overview of ALL was useful. If you have any questions, leave them down in the comments. I hope you consider liking and subscribing. Thank you so much for watching, and I hope you watch some of my other videos.